last but not least, we are talking about carbohydrates. And this is our third video in a series of macronutrients. And we started off with protein, then we talked about fat, and now we're talking about carbohydrates. And who am I? I'm Dr. Lindsay Ogle. I'm a board certified family medicine and obesity medicine physician, and I am passionate about helping prevent and treat metabolic disease through lifestyle optimization and weight management. And I also utilize medications when appropriate. Like I said, we're talking about carbohydrates today. Carbohydrates are very important from a metabolic health standpoint. But when you think about it for your body, they are not essential. So there is no absolute minimum for carbohydrate intake. There are usually limits on how much carbohydrates people want to take in when they are trying to either lose weight or improve their metabolic health. And the reason for this is how carbohydrates affect insulin. So insulin, it deserves its own video, and I will definitely create that here very soon. But insulin is a hormone that helps us control and regulate our blood sugar. And blood sugar is really important. We want to have a specific set amount in our blood. If it goes too low, it's extremely dangerous and we can die very quickly. If it goes too high, it's toxic over time to all parts of our body, and we call that diabetes. And it does not usually cause problems in the short term, but it causes extreme and extensive problems, again, everywhere in our body long term. And unfortunately, diabetes is extremely common. About 1 in 8 American adults have diabetes, and 1 in 3 have pre-diabetes, and so they're at high risk for developing diabetes. So this is something to be aware of, to be tested for, and to monitor. And I bring that all up here in this conversation about carbohydrates and insulin because the more carbohydrates you eat, and especially if we're not being strategic about how we're eating our carbohydrates, the higher our insulin levels will go and our blood sugar levels will go. So this is why this talk is so important for us to review today. So there are really 2 main types of carbohydrates that I want us to focus on in this talk, because I want to keep it as basic as possible so you can learn something that you can implement right away. And the 2 main carbohydrates that I want you to look out for, and the 2 things that I want you to look at are added sugars and fiber. And just to jump to the conclusion here, we want to have as low as added sugar as possible, ideally 0, but having a couple grams here and there is not going to make or break your metabolic health. And then for fiber, we're wanting to have higher amounts. So if you're eating something that has 10 grams of carbs, but 8 of them are fiber, that's pretty good. And you can feel well about eating those foods. Fiber is so important for our health. It has been associated with so many health benefits, from decreasing your risk of cardiovascular conditions or diseases. It has been linked to lower risk for colon cancer, helps us to have regular bowel movements. It improves our gut health, our gut microbiome. It helps to regulate blood sugar and keep our blood sugar levels at a steady level. It helps us feel full during a meal and for longer periods of time. So there are lots of benefits from fiber, and if you are going to take in any carbohydrates, you want to make sure that you are at least getting some fiber in with those. And then the added sugars, this is what you want to avoid if at all possible. So added sugars bring you really no benefit unless you are an athlete and are really needing a quick burst of energy, whether that's you're on a long run in a marathon and you're needing to refuel yourself along the way, or if you are a sprinter and need to quickly give yourself a lot of sugar so your body has the energy to run really fast right away. those are when it can be really beneficial to have that added sugar. Otherwise, on a day-to-day basis, it is not necessary. We do not need any of that. And so looking at labels and then choosing the option that has less added sugar or ideally no added sugar, you are going to see huge improvements in your metabolic health, probably your weight, and probably energy levels. I am shocked when I look at food labels and especially drinks. One that gets me every time that I see it, and honestly upsets me, is when I see the extra sweet tea. We don't need extra sweet tea. The sweet tea is already very sweet, and I will show a link of how much of a difference the added sugars are in these options, and it's quite shocking, and people are not aware. Same thing with juices. Juices have a lot of added sugar without the benefits of the fiber that we see in fruit. So sometimes when people take some of this advice to extreme and they're like, well, fruit has sugar, so I probably shouldn't eat that. It depends. Fruit also has a lot of fiber in it. And so when you eat sugar and fiber together, you're less likely to have those blood sugar spikes. And so if you are going to eat fruit, then eat it whole. Don't juice it. Don't add it to smoothies. You are going to see better results if you're eating your fruit whole. And I'm going to stop there because, like I said, I want to keep things very, very simple for you. If you have any questions, please let me know. Any topics you'd like me to talk about, please comment below, and I would be happy to include that in a future video. Take care. See you next week.